Okay, I'm Routt Reigart. I have been associated with the network since its very beginning. At the time the network got started, I was chair of the Committee on Environmental Health of the American Academy of Pediatrics, based on my interest in children and the environment. And I was invited to a organizational meeting by Joy Carlson. And at that meeting we decided that we would do something, some sort of a group that would promote healthy environments for children. As it evolved, I suddenly found myself chair of the board of the Children's Environmental Health Network. And I did that for 10 years and finally said, you know, it's really time for someone else to be doing this. It was a very exciting 10 years, by the way, and I've remained on the board since because I still feel strongly about the importance of healthy environments for children. And I think one of the things that most drew me to the Children's Environmental Health Network was we, for the first time, were looking at the environment with children at the center. A lot of environmental groups talk about children, but it's the environment first and children second. And our approach has always been children first and the environment as it affects them. So it's a reverse paradigm, and it's very important to me that we keep children at the center of our interest in healthy environments for children. Well, as I look back, when we first started the Children's Environmental Health Network, there were a few areas of interest, such as lead poisoning and children's poisoning, but there was very little in our three areas of importance, which are education, research, and policy. And there was no one really working in those three areas in an active way. And one of our very first and continuing efforts is to educate public health people, health providers, in how to better recognize environmental risk, how to help children with it. It's never been done before. There was no group when we started that was focused on doing policy work at looking at healthy environments for children and pushing our state, local, and federal governments to do more for children in that area. And one of the things that came out of that, well, 20 years ago now, almost, and just shortly after we started, was a presidential, trying to think, it's a policy requiring a consideration of children's environments in all federal policies. And so there was the education, there was the policy, and the third area was research. There was not a great deal of focused research on children's environmental health, and we were very instrumental in getting the federal government to set up centers for pediatric environmental health around the country, primarily through EPA and the National Institute of Environmental Health Sciences. And in fact, we really don't have today to do a lot to push that, because these centers are well established, although they sometimes come under risk, but they're excellent advocates for themselves. And so there has been a little bit of a change in emphasis in the network, more in the policy and education and a little less in the science area. We've gone from virtually no one caring about pediatric environmental health to being a major movement in the country, and the network's been an important part of that, and has always been respected as an honest player, you know, with support from all sides of the political spectrum. You know, we're looking out for children. We're not irrational, extreme in any direction. We're just out there taking care of children, and we're known for that and respected for that by everyone.